Welcome to the Holistic Growth Podcast, navigating business and natural health and functional medicine, where we bring you insights and strategies to help grow your practice and amplify your impact. Welcome, everybody, to the Holistic Business Podcast with GetHealthy Store. I'm Dr. Tracy, and I am the Chief Health Growth Officer right here at GetHealthy. And I'm so excited to have today the Clinical Director of Evexia Diagnostics, Dr. Wayne Sodano. Not only is he an amazing interpreter of blood work and testing of all kind, but he's one of the nicest people I've met. And we had such a great conversation a week or so back, just talking about testing and all kinds of fun stuff. So I'm so excited he's here. I wanted to give you, Doctor, the opportunity to introduce yourself because I'm grateful to have your time today. So why don't you tell our audience a little bit about you?
Well, first, let me start with my age. I'm pushing 70 here, so I've been around for a little while. And as far as background is concerned, I can go back in the 70s to Rutgers University in New Jersey. I grew up in Jersey. From then that point on, I went to Texas Chiropractic College, became a chiropractor. From there, did a course in what's known as the Diplomat of the American Chiropractic Internist course, which is an integrative and also a look at internal medicine, actually from a chiropractic perspective, but they were really heavy on blood chemistries. And so I did that training for quite a few years, and then took the Diplomat of the American Clinical Board of Nutrition, and I have that. And I'm not big on letters after my name, but I'm always grateful for all the individuals that I learned from courses I've done from Dr. Bland. Of course, he's one of the big ones out there. The father of functional medicine, some folks call him, and I know Dr. Jeffrey Lord, if you have his book on integrative and functional medicine way back when in the early 2000s, he really set he and his team. Dr. Alex Braley as well. I think Dr. Tracy probably has that book, I would imagine. Just a wonderful look at functional chemistry and functional blood chemistry. And kind of that leads me into talking about, we were just talking to Dr. Tracy a few minutes ago, essentially about integrative medicine. And I asked her, is that okay if I just give a little explanation of that? And, she gave the nod. So here it goes. This is my take on it. Subject to interpretation, but integrative medicine, you probably all know this, but I just want to set the stage for this. And basically, it's like the integrative medicine, to me, covers everything under that umbrella. The allopathic medicine, the systems medicine. And what I mean by that is even naturopathic medicine, Chinese medicine, traditional Chinese medicine, Ayurvedic medicine, that would fall under systems. But again, it's under that umbrella of integrative medicine. Then you have your biologically based. Looking at the chemistries, the functional medicine, the natural medicine, botanical medicine will fall under that as well. You have your manipulative medicine. That's kind of where I started out. You have your osteopathic medicine and osteopaths. I think they understand. I like the osteopaths where the town I grew up in, by the way, in New Jersey, had this is way back. Oh my gosh, let me date myself here. 50s, and then in the 60s, we had in our town, I'll give you the town, Union, New Jersey, we had a hospital there, Union Memorial Hospital, that was an osteopathic hospital. So go figure, it was right in my back door. And when I was a kid, I did some training there. It was, they had, I don't want to call it like a candy striper if people know what that is way back when, but I was asked to join and I volunteered. So I was kind of under that umbrella where we can help patients out as well when I was a teenager and they gave you training. So that kind of started things going from there. But back to the integrative medicine. And of course you have mind, body, spirit medicine. I could talk 20 hours on that, maybe 20 weeks on that. I think it's just so important for what we do. And of course, there's energy medicine, and then we're back to allopathic medicine. And my point to this, essentially, is that in my perspective, anything that is going to help the patient get better, I think we're obligated to do, whether we can handle that or we know where to send the patient out. That's where a lot of the blood chemistries come in and doing a patient history. I did some research on that when I was teaching patient history, that if you get a good patient history, you're about 80 to 85%, you're going to know what's going on with your patient. And these days we need to do environmental history. You got to do it. The mold, looking for heavy metals, whatever's out there, because our patients will be exposed to this stuff. We can't help it. That is maybe one of my soapboxes that I get on, talking about the environment, on how actually dirty it is. Not political or anything. I'm just talking about, we all know that we're buying bottled water, for crying out loud, but then we're buying bottled water in plastic that can gas out, and that can cause problems. So, I mean, it can go on and on and on. And I'm sure Doc knows really what I'm talking about. Over time, I was honored by Evexia, essentially to say, hey, hey, Wayne, can you read these blood tests? We know you're doing it. We know you're teaching it. You got a couple books under your belt. We'd love to have you on. And my wife calls me the detective for blood chemistries. I love looking at it and trying to figure out what is going on biochemically with the patient via the blood test. And blood chemistry is kind of interesting. Blood in and of itself, I call it the great thief in from way back when. And the reason being, if you have somebody that is, say, their calcium is off, or the electrolytes, or the blood wants to steal the calcium and magnesium, say if it's off, it's going to pull it out of the bone. So you can have an osteoporotic patient or osteopenia, and their blood calcium is absolutely fine. The reason being, because the calcium wants to stay, the blood wants to stay at that specific pH, as you all know, and it will do whatever it takes to make sure that it goes right around 7.2, right in that ballpark. So it will take calcium, magnesium for wherever it can get its hands on to keep it there. Therefore, the blood chemistry is fine, but the patient's not doing well. So you got to kind of keep those things in mind. So that kind of sets the stage. Now, the functional medicine has gotten certainly a lot of play over time. And I like to look at it as the biochemical individuality and what is going on with the chemistry, the chemical pathways. Looking at an organic acid test, it would be one. That was kind of one of the big ones way back when. I love a test, I will tell you, that gets very little play. It is like, I'm kind of again, that's why I told you how old I am. This is like the Rodney Dangerfield test that doesn't get ordered a lot. That's the guidance that don't get any respect. So here's a test that I think is so important that gets very little call on, and it is the RBC, in my opinion now, because I do have my opinions on this. It is the RBC fatty acid test. And just think about this for a moment. You have the phospholipid membrane. Is what lets stuff in and out of a cell, and it is made up of phospholipids, fatty acids, and so forth. And if there is, say, trans fats many years ago, you're not letting stuff in and out of the cell. The cell it gets hard, stuff's not getting out, and now you have cell dysfunction when you're looking at it on a cellular level. So to know what's going on with those fatty acids around the cell membrane for the health of the cell membrane as you're trying to get your patient better, I think what a wonderful test, even for brain function. Remember this, the fatty acids are the eicosanoids. They are anti-inflammatory. And there's some that are inflammatory. You definitely want some inflammatory arachidonic acid. Why do you want that? Well, if you cut yourself or you have a wound, yeah, you want the troops there to try to heal it. So Doc,
Totally.
I've been rolling here, but I'll let you chime in.
You were worried that you wouldn't be able to find things to say. Here we are. So,
Yeah.
well, as everyone can tell, you are an amazing resource of information. It's like you're just a walking encyclopedia when it comes to testing and analyzing it. And the reason that we're doing this podcast today is because we've actually created a full integration between Evexia Diagnostics and GetHealthy Store. So those that have our technology at GetHealthy and an account with Evexia, it's all in one place now. So it's pretty unique what we did. And now I have the pleasure of hanging out with Dr. Wayne periodically, which is like a highlight of my day. And so I would like to talk about, some of the value of testing in clinical practice, because we have to remember not everybody does it. So there's a huge scope that I've noticed at our technology, right? I'm sure as it's the same at Evexia. You have your non-licensed practitioners, you have your licensed, you have your health coaches, you have your naturopaths, you have your medical doctors, you have your functional medical doctors. And so a lot of the testing, what I love about Evexia is there's an eclectic catalog. It's specialty testing, and like you said, for environmental things on the outside that could affect us, and then also looking inside of things that can affect our health, from microbiome to blood markers. So let's just talk about, what do you think is the value of people learning a variety of testing within their clinical practice? Because some people just stick to blood and they don't do anything else. Some people just stick to DNA testing and they don't do anything else. Do you think one test is great, or do you think practitioners should have a wide variety?
Yeah, the latter, the wide variety. But this is my pecking order here as far as testing. First is the comprehensive patient history. Yes, is that a test? No, not really. But does it direct you where you need to go? Absolutely. It's just going to set the tone. And now, and I'm not talking about somebody with acute appendicitis and then they need blood work and then their WPC count is like 20,000 kind of thing. And we're not talking about that. Mainly a lot of these folks, patients are coming into chronic disease. I cannot stress the history enough, the dietary history. A lot of the components, I believe, are missing because it will help expedite you, helping your patient a whole heck of a lot faster. I've seen this over and over again, and and it sounds like I'm preaching, but I will tell you, because it's worked for me. And I got to tell, before I answer that question, I got to tell you this story. This is not from me. This was from a doctor I learned when I did the IFM course many years ago. Institute for Functional Medicine. Oh my gosh, it was more than 20 years ago, and it was just like coming out. And I'm trying to think, Dr. David Jones. Yeah, I got to give credit for him. And I remember him getting up there, and he said, I couldn't figure out what's going on with this patient. And so he said, and let me tell you what I did. I went and I reintroduced myself like I didn't even know who the patient was, and it solicited another history, and I found it. And I never forget that. And I don't know if Doc is still around, but soon after that, I never forgot that. And lo and behold, a week later, I wound up saying I did exactly what he told me to do. And I'd like to give you a quick story. It had to do with a person that had migraines, headaches, that went everywhere, did everything that you can possibly do, lab testing. She had went to here, was on medicine, you name it. This was back maybe about 25 years ago or so, after I had learned that, like a couple of months later. And what had happened, I said, you know what, I'm going to reintroduce myself. I might as well do it. It sounded good to me. So I did. And I said, okay, can you, let's go over. And I did the family history in detail. And I asked, somehow through the grace of the good Lord, I asked her what her husband did for a living. Guess what? He was a crop duster and bringing toxins into the house. So what I told her to do was not to, to tell her husband to take all of his garments off, get rid of the carpet, clean it out. We became aware of that. And 3 months later, after she did that, I kept up with her. No headaches without giving her a darn thing. It was that she was chronically exposed to that. So
Wow.
you still want to do lab work, but the power of that, and I
Mhm.
never forgot that. So thank you, Dr. Jones, wherever you are. As far as answering your question about lab tests, so yeah, so we got the history. So I like basic lab testing. It doesn't have to be like 3 billion tests, but these are the ones that there used to be a commercial. Don't leave home without them. You got to have a CBC. Yeah, you need to have an iron panel. You never want to give iron without the benefit of an iron panel. These are my opinions, so other people may have other ones, but you need to know that. The comprehensive metabolic panel, you got to know what's going on: kidney function, liver function, alkaline phosphatase. Make sure everything is in good shape. But even before you start giving patients anything, particularly doing a detoxification program, just think about that for a moment. You can check on, are they anemic? Thyroid panel, you got to have it. Think about all your patients with all kinds of female hormone imbalances, testosterone imbalances, things of those nature. Hey, if their thyroid's not working right, if they're hypothyroid, guess what? The body is not metabolizing properly. And here's my pet peeve, by the way. I do have one. Please, by God, please do weight, height, blood pressure, and body composition. That hardly gets done. It's like, oh, we don't need to do that. You would be amazed at getting body composition on someone, how much muscle mass they have, how much fat mass they have. You can get an older person, well, they're weighing, their weight is fine, but they may be what's known as sarcopenic obesity, meaning that their muscle is kind of all marbled with fat. And guess what? They are fat on the inside, which means inflammation. We know now that fat tissue is an endocrine organ, That's a whole nother subject. You can cut me back for that one because I love that one. So, but it's an endocrine organ. When you're looking at leptin, and what's the other one? Adiponectin. Sorry, I almost forgot about that one. But again, I'm spinning back to your question. So those are the things. Let me go over the CBC. You want to do the CBC, and I'll go slow, and I'll slow down a little bit. You want to check for anemia. What is going on with anemia? Is this blood loss? Is this iron deficiency? Is this B12? You can pick all of that up if you know blood chemistry is just staring at that thing and looking at the RBC indices. It's amazing what you can garner from that. So you can look at that. Looking at the percentages of the WBC count. I'm more in favor of looking at the absolute counts more than the percentages by far. If you might notice that looking at the LabCorp or Quest lab test results, next to the percentages, they have not established. But they do have the establishment for the absolute counts. And I think that's what you want to focus on. The reason is because the percentages have to add up to 100%. So if you had the neutrophils going high, everything else is going to be low because it all has to add up to 100%. So you're much better off looking at the neutrophils, looking at the neutrophil lymphocyte ratio. I'll have your listeners look that one up because that can be a real good idea of what is going on with the immune system. Is there some dysregulation going on? You can pick up things a lot early with that. So that kind of covers that. When you're looking at the comprehensive metabolic panel, you can do calculations. A lot of times that they don't give you that, and to take a look at the anion gap in there. That's looking at these folks in metabolic acidosis. Are they acidic based on looking at phosphate, chloride? I'm sorry, sodium, potassium, and then chloride, and then CO2, which is essentially a bicarbonate. And you can do the math on that when you take the course. You can really get a good handle on what is going on. Homocysteine is another one I think to take a look at. Homocysteine, most practitioners already know this. I mean, you could have hyperhomocysteinemia, which is a genetic thing, but we're finding a lot with B12, B6, and folic acid being deficient because you don't want homocysteine to go high. It can cause cardiovascular disease. It is also part of methylation, and it's also part of transsulfuration when you look at those pathways, the folate pathway, the methylation pathway. Homocysteine, I just want to give you a little clue. That's one of those analytes that may not get respect on the low end, like I had mentioned, like when it goes low. Well, that looks really good. It may be getting used up to create glutathione when it goes low. So it's something to kind of get a little picture on it when you see it go low. When I mean low, maybe a 5 or 6 or even a 4 when it starts to drop low. Think of oxidative stress. Now, while we're on oxidative stress here, 3 wonderful analytes. Without doing an organic acid test, that will give you a clue. Maybe we need to do that. The first one is uric acid. Uric acid goes high. You got one. Bilirubin being the other one when that starts to go high, because those 2 will give you a sign. Is there something going on with the oxidative stress in that individual? The third one is escaping me right now for some reason, but it'll come back. There is a third one to take a look at. But you can look at these basic blood chemistries when you do a blood chemistry course and say, boy, I can really hone in, figure out what's going on. So the bottom line is you want to get these basic tests down before you start doing the functional test. I just think it makes sense. Say your stool analysis. We'll talk about that. We've got a stool analysis. What if they were hypothyroid and they're constipated? You're going to get a whole different GI microbiome on that alone because they're not going to the bathroom, but properly the way they should, proper bowel movements. They're not making enough of obviously the secretory GLP-1 that comes from the gut, by the way, which is getting a lot of play these days. Look up Wegovy, and all these interesting things. Another conversation for another day. So I like to look at that as a basis. Think of doing like a Dutch test. I think all these tests are wonderful. They all have their place. I really do. But more times than not, when I look at a Dutch test, I'm saying, please order me a thyroid panel. I really want to know what's going on, or are they anemic? So that kind of sets the stage for that.
I'm in agreement. I usually do just a baseline panel, CBC with differentials, CMP, lipid panel, and total serum iron. Like that's my core four. And
Yep.
then I move from there because you can see so much in just that. And on Evexia, so extremely affordable, so extremely affordable to send that entire. And I even sometimes include a full thyroid panel, including antibodies, and it's still only like $75. I mean, remarkably affordable. And I do feel that there's a lot of testing overkill in our industry where it's like we got to do this $500 DNA test, then we got to do this huge GI map. And that's nothing against those. I think they're valuable. But I think in the initial, we do need some baselines, right? That's what the initial consultation is about. It's about the baseline. Where are you in your health? Where are you in your nutrition? Where are you in your lifestyle? Where are your base blood markers? Like, where are you at the foundation so we know what we're working with? And then putting in some solutions from that foundational testing to balance things out. When people come back, you can do the additional testing at that point. So sounds to me like we kind of approach it the same way. I'm very much about talking to the client, listening to what they're saying, keywords, body language. And then you had a great quote from the father of modern medicine. So I'd like you to tell about that, who the father of modern medicine is, and some of the principles that he had established way back when.
Yeah, it's a good read. You can look him up. His name is Sir William Osler, also Dr. William Osler. He was a Canadian physician, but then practiced at Hopkins. The time was around 1850 to 1920 was when he passed away, or somewhere in 1920. Don't quote me on that. But essentially, he created the foundation for the discipline of internal medicine. So, and actually how the system of clinical medicine is done even today. So I like to go back and just talk about him, for a minute. His approach, you got to think about this. At the turn of the 20th century, this doctor is basically, when I was doing lectures, I use this all the time. So, I love repeating myself on this one pretty much. But here's what he said. I mean, just think about that. And here it goes. And I want to make sure I get this right. So here goes. You need to know what kind of person has the disease, not what kind of disease a person has. In other words, talk to your patient. We're back to the patient history. What is going on? Because I remember, can I do one more story? Okay, okay. Actually, I got two, and I will make it really, really
Oh,
quick. Okay.
yeah, that's what podcasts are about. Real life, real people. Let's talk.
Yeah. So my wife and I, was about 25 years ago, we had moved, and I moved next door to an Episcopal priest. And they're allowed to get married. And we became like instant friends. Now, Reverend Jack was 90 at the time. He smoked since he was a child. No, he playing golf almost three times a week because he still preached. But we got talking about health, and I said, Reverend, you've been smoking so for with everything, but for years we know how bad it is. We know what's in cigarettes, and so we had this whole conversation. But he said, I'm very at peace for what I do, and it's kind of an interesting thing. So that's one. So you never know getting a history. And my favorite one, and I'm going to mention her name, Dr. Bethany Hayes. She is a OBGYN, had a practice in Maine. She taught me integrative hormonal balancing. What a wonderful! If you get a chance, look her up. Look at what she's done is absolutely incredible. Dr. Bethany Hayes. I went up for a visit. We went up for a chat up in Maine. I love going up Maine, up in the mountains up there. It's part of the Appalachian Trail. But one day she said, "Yeah, Wayne, come on to my office. We're going to talk. This is when DNA testing was starting. The MTHFR. They had Prometheus. 23andMe was kicking off." And she said, "I really got to share this. I really want to teach." So I'm sitting down and now okay, tell me what you got to know. You all know how that is. We want to know this stuff. So she went over her mother's entire DNA thing and said, "Look, oh my gosh, she might have Alzheimer's. She's got this. This looks so bad." And then she had that smile on her face and like, here it comes. Well, my mother is out on some island somewhere having a good time and having Mai Tais or something. So she said, make sure that you know your patient and always balance it out. I'm not saying that DNA testing is not good because it can really help you out looking at DNA. Is there something that is a fast mobilizer, slow mobilizer? What is going on with the cytochromes, things of that nature? Compt. I think you all know that, so you can really take a look at that. Which leads me to my last point. I absolutely promise. If you're doing methylation tests on someone and looking at DNA for methylation or Compt, catechol methyltransferase, and all those things, and you get the information back, there is so much crossover. What I like to do from a functional thing is, why don't we look at the phenotypic expression? In other words, if you're looking at methylation on that patient strictly from DNA, well, do they need B12? Do they need B6? Do they need betaine? Do they need choline? Do they need? Well, you know what? You can test for that. I tell the clinicians, do a doctor's related data's methylation profile test, or you can do a Genova methylation, and you can get phenotypic expression. It'll look at homocysteine. It'll look at methane. It will take a look at SAM, SAW. It looks at all that, so you can see, are these aberrant genes, whether they're heterozygous or homozygous, are they really kicking in? And there's because there's a lot of crossover. So if you really need to know, do that, but you might want to do lab testing on your patient and look at the phenotypic expression. I do have, since I got another time, I want to talk about B12 for a moment.
Okay.
Sorry. Yeah, I had nothing to say when this started.
On roll. Like we started, like he's like, I'm really not sure I can do this. I was like, your wife was right. After 5 minutes, you're on.
Yeah. So it's the serum B12, dude, that I want to talk about. And be careful when that goes high, on high serum B12, if you're not giving your patient B12. Now, I like methylmalonic acid because that's going to give you a functional look at the functional need for B12, which is a good backup to looking at serum. So looking at serum B12, if it goes high, the serum testing looks at cobalamin, not necessarily B12, and that could be a sign of liver dysfunction. When it goes high, and it's like the patient is, no, they're not taking any B12, they're not doing this, they're not, I don't know what's going on. Look at what's going on with the liver. And realize that maybe something's going on. It can get the extreme is that it's cancer or some type. I've seen that go high as well. So just keep an eye on that, and research it, Google it. There's enough information on the net when you do see it go high, which makes the internet just great. Looking at these particular lab tests. This is the absolute last one I got to tell everybody. Biotin. Be sure to have your patients stay off biotin if they're supplementing at least 3 days prior to lab test, because it can interfere with the methodology of pretty much. I'm just going to do a blanket here, and it's not 100%, but just say it is for right now. Vitamin D levels, TSH levels, thyroid hormone levels, reproductive hormone levels. So just make sure that they're off of it. There are some labs, test companies that say, well, you can do so much B12, B7 biotin, that it's not going to interfere. But I'd rather just not have that as a variant to mess up lab tests. So anyway.
Post-COVID, right? Everybody was on some sort of biotin, especially 6,000 micrograms. And it was always a question that I asked when they would bring me labs, and their TSH was off. And I was like, are you taking any hair restoration products? And they're like, oh, yeah, I take this one, and it has like 20 million micrograms of biotin. I was like, we rerun the thyroid, so it does impact it. So that's really good advice. So this has been wonderful, and you can tell how passionate you are. So you do offer some education on the Evexia site. Can you just talk a little bit about what you do on there and how you educate, and also that they can get your book through the Evexia site?
Yeah. I've written a book on integrative blood chemistries. Let me get the full name of that.
It's not a book. It's a Bible. It's not a book. It's enormous.
It's got a lot of. I can have a lot of good stuff, but this was kind of like my brain on paper, and I thank my dear wife Catherine for putting this together, because I wouldn't have been able to do it without her. Believe me, this is the integrative and functional medicine approach to basic and advanced laboratory interpretation, a clinician's desk reference. So it's got a long title to it. What I like about the book is if you want to know, it's got many sections in there on thyroid, on looking at anemia, on what potentially can cause that and where you need to go by looking at a CBC. You can say, okay, is this blood loss? Is there something going on? Is this something going on with the kidney? Kidney meaning that there's kidney dysfunction, and erythropoietin which is made by the kidney, is not telling the blood to make more red blood cells, kind of thing. So this guides you on on what's going on with the patient. The back of the book has analytes. There are 250 or so analytes that arduously went through looking at when you see the blood chemistries off, and you got to flip through and say you can just pick up anything, potassium, whatever, and it's going to say, okay, is what would cause it to go high and low that has nothing to do with the patients with the disease. In other words, they're dehydrated. And by the way, if you see albumin go high on a lab test, odds are they're dehydrated. It's going to throw a whole bunch of other things off. Dehydration will do that, hemoconcentration. So it will let you know that, and it'll let you know, okay, what diseases will cause the analyte to go high and low. And then the third part on each analyte is, are there drug-induced changes that will cause particular drugs to change that particular analyte? And that's back to your history if you know that. So it can be really helpful. Because I think, Doc, we know that a lot of times I've had patients come in and their symptoms were pretty much due to the medications that they were on. And then you got to find out why were they on it. And then you go back and try to fix the chemistry, whatever it is. We find that quite often. So, yeah. So, and also as far as educational, the Evexia, I think it's 8 or 9 videos that I did a CBC blood chemistry course that I talk about integrative medicine. I talk about functional medicine and how the optimal ranges were created and how they were used. This all started back in the 80s. I have the honor of knowing the individual and individuals that actually started this really back in the 80s to take a deeper look at blood chemistries from an integrative perspective, but also looking at optimal ranges. It's kind of interesting. Their goal had nothing to do with functional medicine or anything. Their goal was to see, can we pick up cancer on lab tests? And they had which was kind of interesting. They had case histories. I think there was like 15,000 or 20,000. So they knew what the diseases were. So they reverse engineered this thing on the blood chemistries because they already knew what the disease was. So then they went back and looked at the blood chemistries and said, wow, that's why this looks like this was off. So it was kind of a cool way to do that. Anyway, so that information is on there as well.
That's great. Yeah, so make sure that everybody goes to the EvexiaDiagnostics.com website. We'll put that all in the show notes so you can find the educational courses. Now, Dr. Wayne, are these courses reserved for people that have an account with Evexia? And how much is it to sign up with Evexia to get an account?
Well, you think I would know after 7 years, wouldn't you?
It's free. I'll spoil it for you. So there's
Okay.
2 options. There's a free version, and then there's an option where they can sign up for $50 a year that gets blood interpretation done for them. So if they're not an expert like you, or they're just learning, they can do this. But please know that Evexia Diagnostics offers more than just blood chemistry testing. They offer 2,200 plus tests on their technology. It is an amazing resource and super affordable, now fully integrated into the GetHealthy store. So as we wrap up, this has been so great. I've been taking notes because you just have these little nuggets that you throw out there and you don't even know you're doing it. So everybody should go back and re-listen to this podcast and have a pen and paper. But do you want to leave us with anything when it comes to utilizing testing in your practice and the wave of integrative medicine and where it needs to go? How can you tie this all together for our listeners?
Again, I'm back to taking your time. We're back to the history again, making sure that is going to really set the stage on what's going on, and finding out one thing that I will tell you that, and many things, is ask your patient this question. The chronically ill I'm talking about, ask them this. This is a good starting point. When was the last time you felt well? Lock in on that. It could be a year ago, it could be 15 years ago. And when they say, oh yeah, when I was 15, and by the time I got 16, I wasn't feeling well. Look at the history right then and there. What happened?
Yep.
So, yeah.
And not just physical, right? Emotional too.
Yes. Oh, yeah. No, there's no doubt. They could have been out on swimming in a pond somewhere and had, got parasitic infections
Giardia,
that
yeah.
that will zap iron out of the body
Mhm.
all the time, and nutrients while they're nutritionally deficient, and that would lead you, hey, okay, well, you went X, Y, and Z, or you went here and you went here. Or they had a bad gastrointestinal infection, when you can get post-infection gastritis, which is nasty from a really bad infection, and the GI tract just never seems to get on track. We have a way to check for that stool analysis and go ahead and fix it through integrative medicine. So, but when you get that history, you say, okay, now that makes sense. So I would do that, looking at that, and then always, kind of repeating myself, but start out in me with the basic lab testing. Make sure that the thyroid's doing okay. With regard to the iron test, make sure you do the entire panel. I didn't know there was this much iron overload in the world. I guess because I do this for a living, and I'm talking about patients taking too much iron, which is going to rust your body, cause oxidative stress, just like, just like on a car fender that's got paint off of it. You're going to internally rust, cause oxidative damage doing that. And I didn't realize how much hemochromatosis it's a genetic condition. I didn't realize how much was out there.
Yeah, it's
Um,
amazing. I ran into
yeah,
a couple of people
it's like,
have it.
when I read about it, like 40 years ago, like, yeah, all right, that's nice. And oh my gosh.
And I've
So
ran into stress-induced hemochromatosis, which is pretty unique, so
yeah,
it's not only genetic, but it can be acquired. So it's pretty interesting. The iron test, it's so valuable. It's not
yeah,
just how much iron, it's how is your body using it and what is
yeah.
it doing with it. So I love all of this. Dr. Wayne, thank you so much. I hope you'll
Well,
come back and we
oh,
can
I would love to. I'm sorry. I may have talked entirely too
No,
much, but I love this stuff. So if it's not obvious.
absolutely not. This was full of little nuggets, and I hope everyone can re-listen. Make sure, guys, that if you don't have a Get Healthy store, that you get a free demo. The link is here in the show notes. Also, the link to Evexia Diagnostics and Dr. Wayne's book and all of his classes that he teaches there, I will put into the show notes as well. Share this with somebody who you feel would benefit from understanding this incredible partnership between Evexia and Get Healthy and being able to offer these incredible tests through your store to your patients and clients. Don't forget to subscribe and also to have an awesome day. Dr. Wayne, thanks for being here so much. Appreciate you so much.
Thank you, Dr. Tracy. Everyone have a wonderful day. Bye-bye now.